आता IDICON 2022च्या शेवटच्या सेशनसाठी आपण सगळेजण जमलेलो आहोत. हे शेवटचं सेशन सगळ्यांच्या जिव्हाळ्याचं आहे, कारण वैद्यकीय सेवेचं खाजगीकरण आणि खाजगीकरणानंतर कॉर्पोरेटकरण ज्या झपाट्याने होतंय त्या पार्श्वभूमीवरती एक आपण इंटरेस्टिंग डिबेट ठेवला आहे. साताऱ्यातले प्रसिद्ध न्यूरोसर्जन डॉक्टर अनिल पाटील सर आणि साताऱ्यातील प्रसिद्ध अस्थिरोग तज्ञ डॉक्टर शरद जगताप सर, त्यांची मी थोडक्यात ओळख करून देते. डॉक्टर अनिल पाटील सर MS आणि MCH न्यूरोसर्जरी आहेत. हॉस्पिटल बिल्डिंगचा त्यांना गाढा अनुभव आहे, त्यामुळेच बहुतेक असं दिसतंय की कॉर्पोरेट हॉस्पिटलच्या संदर्भाने बोलण्यासाठी आपण त्यांना निमंत्रित केलं आहे. 1997 साली 6 बेडेड जनरल हॉस्पिटल आमच्या घराच्या शेजारीच एकत्र होतो आम्ही. मला आठवतंय एका घरात, त्यांच्या घरामध्ये त्यांनी खालच्या मजल्यावरती एक छोटंसं हॉस्पिटल सुरू केलं होतं आणि आता 2019 मध्ये 60 बेडेड मल्टी स्पेशालिटी हॉस्पिटल त्यांचं साताऱ्यामध्ये मोठ्या दिमाखात उभं आहे. मी डॉक्टर अनिल पाटील सर यांना विनंती करते की त्यांनी त्यांचे व्ह्यूज मांडावेत.
So we are now in the slog wars. Me and Sharad is going to speak, and we are the last batsman. And we are going to debate on nursing home versus corporate hospital. Obviously, I am going to lose because I am in a minority. I hope that this presentation will prove effective. So should I start using my mouse? Okay. So I have 10 minutes to speak on the corporate hospital. Sharad is going to speak for 10 minutes on the nursing home. And probably this is the session or the last presentation where the audience will get a chance to opine or ask question. And if possible, the organizer will unmute you if it is in a time, but the time bound is after finishing both of us, there will be 10-minute session, 20-minute session for the discussion, and every participant or question will be entertained only for 1 minute. That's the limitation. So now I start my 10 minutes. So now, if you are a patient, let it be medico or non-medico, where you prefer to get treated, you answer your question very honestly and you will get the answer. Please play the video. So now you know that what we want. What you want as a patient is different, and what you want as a doctor is different. So now what is a corporate hospital? In the real sense, the definition is just united or combined into one. That is the definition of corporate. You apply for hospital, it is the remains same. Now for this, the another question is share value of Apollo hospital is 4,500. Those people who play in share or market, they know that what is the meaning of share value of Apollo hospitals is 4,500, and it is at lower level, lowest level, and Apollo group is going to be taken over by some other multinational. Is it justified? That means corporate hospital is justified or not. Now this is one of the slide where the CEO of the one of the topmost group of the hospital, who is supposed to be paid per year for 6 crores and who is not a doctor, says that are the private hospitals. In her view, corporate hospitals are in crisis mode. The next slide is why corporate hospitals are changing hands in India only, because they are failing. But we want the same treatment which we see over there. That's the limitation. Now, what is the best for the patient? In emergency, fast investigation with fast treatment, multiple options of consultants of different specialty, best possible treatment plan with available resources. What he wants in elective, best possible treatment with best and fully qualified consultants. Maybe it's super consultant or subspecialty consultant or subspecialty. Best equipments, best results with zero complications. Now the question is, in emergency, requirements are like this. And what we are seeing at the center is nursing home. In the Western, the literally meaning of the nursing home is a vruddhashram. But even if you don't take in that terminology, are we coping up with the requirements, current requirements? So what is the emergency requirement? Door to needle time for every emergency, primary treatment for shock, for respiratory distress, failure, CCF, unconscious patient, trauma. What is needed is qualified trained staff, junior doctors, intensivist, consultant, OT technician, ward boys, technicians for the diagnostic modalities, n number of diagnostic modalities, emergency interventions like reductions, ICD insertion, thrombolysis, emergency, angioplasty, laparotomy, amputations, vascular repair, XYZ. Now, what are the resources are needed? They are divided into human resources, machinery resources, and third one is the space resource. Human resources are qualified staff nurse, qualified doctor, qualified specialty consultants, class 3, class 4 for shifting, helping, blah, 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 administrative work, responsibilities. Machinery resources are again the investigations, CT scan, USG, DSA, cath lab. Treatment modalities are ventilator, OT equipments, dialysis, ECMO. Space, ideal spaces for the everything, casualty, diagnostics, OT complexes, consulting, the list is unending. Now, what are the advantages of corporate hospital? Do we know that what are the medical legal aspects? I am giving only 2 examples. Defibrillator availability in a theater or in a hospital, nursing home is mandatory. If you ask yourself that how many nursing homes are carrying the defibrillators in their theater as well as in their wards also. Second is culture sensitivity reports regularly to be done of the equipments, operation theaters, ICUs. How many of us nursing homes and all those are doing? It's not possible for nursing home to cope up these medical legal aspects because it needs a protocol based work which can be done only in a corporate setup or a system. And we are lagging this, and today or tomorrow or day is going to come when these problems we have to face, we have to answer in the court even. There are people, now these are the various equipments and costly equipments which can cost in crores, and people are demanding for these equipments. We are taking away our side from there. We are neglecting these demands, but they are there. People are not coming to us because we are not answering those questions. So maximum utilization of the advanced costly technologies, equipments by multiple consultants by multiple times is the advantage, another advantage of your corporate setups. Now, sharing the responsibility. Involvement of other consultants is very easily available in a good times or even in a bad times. Working together and cross consultations are helpful to solve the diagnostic dilemmas and can justify the patient in much better way. Can anybody deny this? Is it possible in nursing home? Very difficult. I do not agree with that. Patient satisfaction index. Best ambience with best basic facilities. I am showing the photograph of a general ward of a corporate hospital. Second example, patient satisfaction index, pathology or a pharmacy pneumatic tubing system. Are we aware of it? When an old man of 70 years old person who cannot walk, whose knees are very badly affected, having severe pain, and he rushes 2 floors down or 1 floor down for just to bring one needle in your nursing home, how much painful for him. And every time your sister or your work doctor or junior doctor, somebody is saying that go and bring this and go and bring this, and he has to rush these 2 floors. How painful it is. Are we providing this? Are we thinking on these things? Assurance of best treatment by treatment. In a nursing home, same surgeon operates, same surgeon takes out the RT, he just counts everything. He says also what is the urine output, is the bag is emptied or not. Then he himself gives us some physiotherapy, if at all he is worried about that, or he mobilizes him, he does everything. He supposes that he is a Superman. Okay, agreed. Now, what about the academics, clinical meetings, and clinical progress? Why do 90% consultant-owned nursing homes close and or slow down by the age of his or her 60s? Possible causes are fatigue due to burden of non-clinical administrative work, monotonous work pattern, no improvement in academic, surgical, or clinical skill as more energy and time spent on administrative or non-clinical work. Are we taking the proper holidays? Teaching with advantages of hierarchy pattern. Do we have the pleasure of these things when we practice in a nursing home? Best way to live a doctor lives is student, then junior faculty, then senior faculty, then HOD, then professor emeritus, graceful retirement. Are we fitting anywhere in this? Do nursing home owner have graceful way of retirement other than handing over it to your sibling? Today's advantage can be tomorrow's burden. Changing trend has to be accepted. From nursing home to multi-speciality hospital owned by the working consultants to corporate. If we consider our town only, there are more than 120 nursing homes. Only 9 multi-speciality or multidisciplinary, I use multidisciplinary word, owned by working consultants. And there is no corporate hospital. Now disadvantages, money, 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 money. Exploitation of the patient, exploitation of the consultants. Can it be avoided? Now, if you can, roughly I can say that this is around the data, nursing home, multi-speciality, corporate. Service expenses, 30% are only spent on in the nursing home. Multi-speciality are spending 40% on the service expenses, whereas corporates are spending almost 50% of their revenues on the service expenses. Consultant earning is 70% in the nursing home, whereas 20 to 40% in the multi-speciality, whereas only 10 to 15% in corporate. As like that, the owner profit goes down. The advantage is, comment is, everybody knows. To conclude, instead of providing chapter services, cheaper services, so-called cost-saving module with maximum earning, but with significantly stressful, relatively lonely and uncomfortable working environment, with wastage of lot of time on non-clinical work. Is it a donkey work? I say yes. Hampering your clinical and academic progress. Why not to choose joyful and relatively stress-free life in an intellectful environment with maximum working comfort and enjoying pleasure of working as a group, along with academic and clinical improvement, with a choice of timely, graceful retirement. Thank you.
Dr. Anil Patil, corporate systemचा जोरदार पुरस्कार केल्याबद्दल. आता मी डॉक्टर शरद जगताप यांना विनंती करते की त्यांनी नर्सिंग होमची बाजू मांडावी.
Thank you all. My sir has shown a very big hospitals, and I seen that these big hospitals, only one answer is not a common man, is not for a common man. My hospital is small, but with fully equipped facilities for a common man. I am secretary, I am Satara, owner of my Sanchit Accident and Maternity Hospital, Satara. So this is my small setup, not a very big hospital, but I am satisfied in that. Which is having autonomous management. I single-handed my hospital very well. Single-handed means whatever I want, I can do it in my hospital. I develop the infrastructure single-handedly, and so I can manage it very well. It is like an one-man army. It is having a decision making is very easy in my hospital because decisions are only depend on me. No need to take a meeting, no need to pass any resolution, no need to gather all the corporate sectors and take the decision. Only one me. It is very, and so that management becomes very organized and it is well disciplined. Suppose I told the sister to have a Jelco, and I know my staff is able to do the Jelco or run the saline. In the corporate hospitals, the doctors tell that give the IV, give the saline, but they don't know whether that particular staff is capable or not. Billing of the patient is always in your hand. It doesn't depend upon any other thing. Profit and loss can be easily handled at the time of crisis. We know in the type of crisis what these hospitals are changed, and the nursing homes were running with fully equipped facilities and giving their all to the patients in the time of crisis. Flexibility and independence. Working as per our convenience. We work as per our convenience. We can prepare or we can timed our OTs, timed our OPDs. We can manage ourselves at the time for our families. And this is the convenience we solely give to ourselves, which is possible in our only setup, not in the corporate hospitals. We can work as per our strength and capacity. That strength and capacity doesn't depend upon anyone or a corporate sector. Yes, no target achievement or management pressure. Nobody is there to tell us what target we have to achieve, and for that what we have to do. Management is ours, target is ours, and pressure is also ours. Care options can be chosen by ourselves. Yes, really, not each and every patient is treated in my hospital because I choose them. Treatment options, I choose. And then, because of this choosy atmosphere in my hospitals, I can give a best care to the patients which I choose. I have day-to-day business operations which is controlled by me, not by other means. If one corporate hospitals, they are changing all the doctors, all the staffs every day. So new staff is having new business activities which he is not knowing. Which type of structure it is, he is not knowing. And it is very difficult to control all the doctors in that business operations in that corporate hospitals. Setting tone of daily office culture is very nice in my hospital because I know my staff, I choose my staff, and the setting is very easy for that in my setup. Independence leads to best care because I am independent and I choose the patients, I choose the treatment options, whatever it may be, but the independence is on my side. Nursing homes with the doctors, residence is the beneficial for time management and family life. Yes, most of the nursing homes are attached with their residence. The big hospitals are not having any residence. Doctor is living aside. He is busy in other work also in his private OPDs. He cannot come to see the patient. I see the patient myself first, and then all the treatment is going to start with my opinion, not with the houseman's. So quality of care, this is also very important aspect in the private nursing homes. Personally, I can take care of my patients. So what happens? It increases the trust and satisfaction of the patients, which also gives good clinical outcome, and it also ultimately helps in good image building of the doctor and the hospital. Following your dreams and goals. जेव्हा आपण MBBS ला ऍडमिशन घेतो, ज्यावेळेला आपण PG साठी ऍडमिशन घेतो, the path you dreams, the goals can be planned right from the beginning. At that time we start our practice with keeping some goals and dreams in our mind, then which can lead towards it step by step, as you are the only decision maker, which ultimately leads to improvisation of the infrastructure. Maybe it's small. Madam mentioned, sir started his hospital with the 6-bedded hospital. He was satisfied in that setup also. At that time, I was remembering, Sharad, yeto kare assist karaila. I was going very happily, and sir was also happy in that setup. And so ultimately, it leads to improvisation of the infrastructure. Yes, he goes to big setup, he goes to big thing, but not individually. By taking others' help, I also got to new setup. I also build up a good improvisation in my infrastructure, but individually, not with the others' help, which leads to good quality of care and services, which gives me mental and professional satisfaction, and which is the ultimate goal of every doctor, not buildings and taking others in the service of the patients, but ultimate goal of every doctor is a mental and professional satisfaction. So doctor-patient relationship is very important aspect in each and every doctor's life. It is in the nursing home, there is a better communication of the doctor with patient and relatives, which gives us more comfortable and affordable feeling to the patients. It gives more trust and less conflicts. Definitely the conflicts what causes is very important in our doctor's life, which leads to strengthening and reinforcement of the family doctor concept. And this is a time-tested concept which will remain forever, and it is a need of our in these days also. Future of the nursing home practice. Yes, I know future of the nursing home practice is very much debated, but I would like to say more than tall and flashy buildings of the hospitals, the trustworthy doctors and genuine treatment is the soul of the medicine practice. Not the equipments, but not the buildings and not the shareholders and not the share of the hospital is very important, but the trustworthy doctors and genuine treatment is very important in that particular hospital, maybe the corporate hospital, individual hospital, or anywhere. Shares, common man, people will not come. What is the share of the hospital, and then he will come in to take the treatment. It is the doctor which is giving service is very important for that common man. So however type of medical practices develop in the future, nursing homes will always stand tall and close to the heart of people. So nursing homes are not dying, but they are evolving. So conclusion, to conclude with, it is not the type of practices important, but the trust of patient on the doctor and the genuine affordable services to the common man is very important, my sir. And so I conclude my talk in this.
धन्यवाद डॉक्टर शरद. आता खूपच मोठा प्रश्न आहे की स्ट्रेस कमी कुठल्या सेटअप मध्ये आहे, कॉर्पोरेट सेटअप मध्ये आहे का प्रायव्हेट सेक्टर मध्ये आहे, आणि प्रायव्हेट किंवा पर्सनल टच असलेली ट्रीटमेंट जास्त चांगली का प्रोफेशनली इक्विप असलेली ट्रीटमेंट जास्त चांगली. आता मला वाटते पण युवराज सरांकडे माईक देते मी.
फॉर बोथ ऑफ यू, स्पेसिफिकली फॉर the one who has pleaded for corporate, there is a beautiful question. What about the work pressure of working doctors in the corporate hospitals, target achievements and all? And what about the control? What about the control of all the decisions to be taken, to be made in the corporate hospitals or
So again, it is about the work pressure on the consultant put by the corporate or corporate hospital. Do you think that a established consultant working in a corporate hospital, like say name, per se I am taking name, Hiramat sir, is having a target? So retrospectively, what I showed is the answer. You get the degree, you work for 1 year somewhere, and then you declare yourself as a consultant and you join some corporate hospital. Obviously, you are sitting there, you are occupying something, and still you are not enough mature to occupy that place. Then obviously you feel that the corporate people are putting target in front of you and you are not able to achieve it, so they are pressurizing you. If you are enough mature, like senior consultant, or enough mature to acquire that much patience, then only you sit in that chair. Those consultants, senior faculties, those who have spent 10 years, 15 years as a professor or a junior consultant to some senior consultant in somewhere in corporate hospital, and then they are occupying one cabin nearby to it or in that hospital or some other corporate hospital, they are never complaining about that. It is your premature entry into that consultant chair which brings this pressure to you. That is my answer. I have experienced this. Go in any big corporate hospital, the consultants are of more than 50 years of age or 40 years of age. Till then, there are junior consultants with them and they are not asked any single question about this. How many patients you are bringing? You talk with the people working in the Medanta, you talk with the people working in the Paras hospital or even in Bombay. They come with their patient because they enter in that chair, consultant chair at the age of 50. If you try to enter in that chair by the age of 32 or 35, obviously you are going to get that pressure. And that pressure is same when you open your own private hospital in the second year of passing your degree. That is the answer.
So, Hiremat sir can go to the corporate hospital. Not a junior person can go to the corporate
So
hospital.
you
it is
become
clear.
first the senior.
No, wait.
Okay, there are many questions coming up. There is another very nice question. The question says, what about the difference of time given by a doctor, a respective treating doctor, to the patient and the satisfaction of the patient by regarding the time given by a consulting doctor to the patient in both the setups?
No.
I will tell first.
Answer.
I will tell first. My time is 100%. In the private nursing home, we give the 100% to each and every patient. Firstly, and to the last, up to take out the stitches, and not only take out the stitches, but putting hand on his back. How are you? Whether you are good, and how it is your opinion regarding your treatment and facilities by our hospital. I give the 100%.
Okay, another second question.
Can I answer this question?
Okay, sir. Yes, sir.
So I really appreciate your devotion towards the patient, and you are a very good doctor. But when you get a call at 12 now in the midnight, or the patient just knocks your door when you are staying above your nursing home and says that my patient is not passing the stool, then what is your opinion? Are you giving 100%?
Yes.
And are you going to spend your whole life like this? That in twice in a week, middle of night, they are coming and knocking your head. And even when the patient is serious, they are just sitting in front of you all the time. They are not allowing you to enter your home. Don't you think that this is the biggest limitation of your strategy, which you are promoting, that you are giving 100% base, tapping your patient, taking out your suture, doing everything yourself? Don't you think the black side of your promotion?
No,
Okay,
sir.
sir. So,
No,
a similar question supplementary to this is, what about the sharing of responsibilities and the stress on both the sides, in both the setups?
Frankly speaking, both of us have not worked in corporate. The question can be answered in a correct way by only person who has experienced a private as well as now experiences a corporate. The good person was Dr. Rahul Yadav, but he is not online. I tried to bring him to online, but he is the correct person to answer this question. But I know that the bigger the setup, the more people are working under you, lesser is the stress. These are called as the filters. You cannot take on every warrior on your head. प्रत्येक येणारा सैनिक 10 नातेवाईक येतात तोच प्रश्न विचारतात, 15 नातेवाईक येतात तोच प्रश्न विचारतात. पेशंट बेशुद्ध काय, पेशंटचा पाय का हलत नाही? Why you need to bear all these things all time? In your branch, the questions may be different, but you have to answer all the time.
Yes, sir. We have to answer all the time.
You are great.
I want to say something.
Definitely. I just want to add something regarding your first opinion about midnight. Yes, it is definitely necessary. We can't go. I agree with you each and every time, but it is the necessity. You just compare that midnight call is going to that particular doctor in the private nursing home who is working in the private nursing home, and the same call is going to the
doctor who is working in the corporate hospital. Now you tell me to whom it is very easy to attend it. It
Why
is
for-
definitely in the private nursing home doctor who can able to attend daily that such a type of calls. And that type of image is very important for that particular doctor in building the patient relationship, doctor-patient relationship. Not only relationship, but those relationship will be forever and healthy.
My answer is this question have only value if it is a patient of GI surgery. Apart from that, this should not reach to the treating consultant. Orthopedic patient not passing stool has nothing to do. Simple over there in the ward in the corporate hospital, that staff only says that we have to give 2 tablet Dulcolax or we have to give enema. At max, it goes up to the on-duty houseman. It doesn't go to the treating
Okay, sir.
consultant.
Now we are going to take another question.
8 minutes.
Avinash Bhosle, sir.
Dr. Anil Patil, it is said that too many cooks spoil the broth, that many consultants are there, and what the consultant give the prescription or notes on that are not implemented. Many times I have seen in corporate hospital. म्हणजे त्या सगळ्या नुसत्या ज्या काही इन्स्ट्रक्शन असतील त्या फक्त तुमच्या त्या पेपरवर असतात आणि आपण 2 तास केलं 3 तास केलं तरी ते इन्स्ट्रक्शन नसतं, त्या इम्प्लिमेंट झालेलं नसतं. व्हॉट यू से अबाउट दिस?
So now here the correct question is there can be 2 parts. There can be contradictory orders given by the 2 different consultants. Maybe it a cross consultation or a single patient, VIP patient or a single patient which is difficult disease, having 2 or 3 consultants and they are just giving the orders and they are not implemented. It has 2 parts. Either there can be a failure at the level of the implementation of the orders, or there can be a failure to take the decision who's to be followed. This can happen.
Ultimately, it is the loss
This
of
can
patient.
happen anywhere. Doesn't
Ultimately,
mean that
it is
it
the
won't
loss of
happen in the
patient.
nursing home.
Yes,
This
it
doesn't mean that it happens in the room.
less chances.
You are pretending as if the nursing home owners are against the Durga. They
Yes.
are having 10 hands and they are doing everything by 10 hands.
We have to
I am
do it,
doing
sir.
this also, I am doing this also, I am doing this also, I am doing this also.
Because you admitted the patient of multiple problems, you have to face such problems in such a way that they should be satisfied by any means. Whether the persons are more, staff is more, trained or untrained, whatever it may be. In my hospital, I admit the patient of one specialty, one particular patient of my choice, so I can handle it very well. This is the problem.
Okay,
In the
now-
corporate hospital, if you want to admit in the multidisciplinary patient, then you have to tackle in that way only, because you have a corporate hospital, which is not going on properly.
Okay, now as a layman or a general practitioner maybe, see, I'm having 2 types of patients. One patient is having multiple problems and one patient is having minor ailment. Now, just tell me where this patient should go and end up and where he can get a good type of care.
The question is not properly put forward. A patient who can be managed on OPD, where he should go, whether he goes to any private OPD or he goes in a OPD of a corporate hospital, it is his choice. But when the time comes that when or where he should be admitted for the treatment, at that time this question arises, whether he should be admitted in the corporate hospital or he should go to get admitted in the nursing home. And here the Indian system is failing. What is happening in Indian system is 70 to 80% of the admissions which can be very easily treated are getting admitted in the nursing hospitals, and when they come to know that either it cannot be treated, it is a bad or it is a boomerang, then they have been transferred or sent to the corporate hospital.
Vice
Now,
versa can
let me complete. Now, here is the crux. Why the corporates are failing. Corporates will succeed, and they have succeeded in the world anywhere, even in the UK or US or everywhere, because apart from getting admitted these bad and critical patients, routine patients are also getting admitted in the corporate, and over there the every compensation is happening. Here, why there is an image that nursing homes are cheaper and the corporate hospitals are 10 times costlier, because most of the patients who are getting admitted in the corporate hospitals are having multiple problems and difficult and critical diseases. Obviously, they have to bear all that cost. Here, the everything lies.
Okay, sir. Good. So, do you want to express, Sharad
Yes,
sir?
yes. Whatever he is explaining, sir is explaining, vice versa can happen.
Because that is what I am saying. They
Vice
should
versa
be-
is happening because the corporate hospitals are not managing that patients very well. They are not sending those patients to the nursing homes. They are managing that patient on their own way, and which is the failure of the corporate hospitals.
No, you are interpreting in wrong way.
Okay, sir. So there is another. There are last 2 minutes we have left with. So there is another one nice statement given in the chat box. The statement says, as long as corporate hospitals are not exploiting patients, they are good. So what about this? Please, both of you elaborate on this. This will be the last question we'll take.
Please repeat.
As long as corporate hospitals are not exploiting patients, they are good. This is a statement which we have received in the chat box. So please elaborate this
I
statement.
will elaborate first, then Sharad will
Like,
elaborate.
one thing I will add here, regarding the pharmacy billing, there is unwanted use of medicine which we have seen in mostly corporate sector. As compared to nursing sector, for example, in a cesarean section, nursing home, we get a minimum billing for pharmacy, and same billing in case of same case cesarean in corporate goes 3 times high. Can you explain why this is different?
So now we come to the bottom line that
The same,
Yes.
same. Both the questions
now
are on the
we
same
come
ground.
to the bottom line that is there a exploitation of the patient in the corporate hospital compared to the nursing home? That is the crux of these both questions. Both questions are same. Now, good and bad things are happening everywhere. Do you think that this exploitation is not happening in the nursing homes? Do you think it? If you say, you are lying. This happens everywhere. This happens in few of the nursing homes as well as this happens in the corporate group also. So good and bad is everywhere. If only corporates are doing this, then all the corporates would not have been full. I tell you, all the corporate hospitals started in last 7 years. Now at the completion of the 7 years in Pune are fully occupied. You need to book the bed. From the Dinanath to 3 years back started 500 crores project of the Jupiter. Now why this is happening? And why so many of the nursing homes beds are empty? Now how you answer? The exploitation is everywhere. It is that system's policy. Don't make it a generalization. Don't make it a generalization. It happens in the nursing home also, it happens in a multi-specialty also, and it happens in a corporate also. Only the deciding body is doing this. It cannot be generalized.
Okay, Sharad sir, your views, please.
I have seen patients who have given fixed packages. For example, I am not promoting any hospital. X hospital in Pune has made a package of 20,000 per day ICU. It includes antibiotic, whatever antibiotic it uses. Let it be meropenem or colistin or whatever. And it can go to 1 lakh in KDA. So you cannot compare everything like simple thing.
Okay,
No,
Sharad
sir.
sir.
Giving the package concept is very well accepted in the nursing home rather than the corporate hospital. By giving the package system, it is not trustworthy that package system is followed in the corporate hospital. First thing. Second thing about the exploitation, I also agree that whatever it may be, whichever hospital it may be, there should not be exploitation. I also feeling the same thing. But unfortunately, this is happening much more in the corporate hospitals than the nursing home practice. We see that your ICU beds and corporate hospital beds are full and nursing hospital beds are empty. It is not like that. Corporate hospitals are full, equipped, and the beds are not empty. It is because of other policies. It is because of the insurance sector which is coming up and taking over these corporate hospitals, which debate is other. And these things are going to happen there are enough bed there to occupy these insurance companies, and so these hospitals and beds are full. It is not happening with the nursing home, but still I have shown in my slide, they are not dying. They are evolving and they will sustain.
Okay, sir. Thank you. This is going to be a Tom and Jerry like picture now. So we have to stop somewhere. We have to conclude somewhere. We have received one very nice message in the chat box, which says we need both the setups. That is a need of a time, depending upon the emergency indications, planned indications, morbidities, comorbidities, and everything. So let us conclude. I'll give one minute, both of you, to give your final statement on your debate. 1 minute, please. The time starts now for Sharad sir.
I say that the corporate hospital or the private nursing home, whatever it may be, as I have already said, the better communication with the patient, better trust of the patient with affordable feelings to that patient is he should take home with these aspects after taking the treatment, then these investments and multi-speciality hospitals and corporate hospitals, whatever they are doing, the most important thing is trust of the patient on that particular doctor, not on the buildings.
Thank you, sir. Now, Anil Patil, sir.
So now I will elaborate all these things. Number one, are we looking for the ideal system? Then we are following NHS as an ideal system. And what is there in a NHS? There are no nursing homes. Okay, our society is different and we are living in a different poor country. The next sentence comes that a doctor's primary job is not to save the patient's money. The doctor's primary job is treat him perfectly, properly, best possible, with best results, with the best possible technologies. If you all the time keep on saying that the patient's money has to be saved, patient have money has to be saved, obviously there is a threat that you are going to offer suboptimal services and suboptimal treatment to the patient with the suboptimal results. About the exploitation of the patient, I totally agree that there is some exploitation in both sectors. Maybe in corporate it may be a slightly higher, but the person who wants the best, he has to pay the best. That's all.
Okay.
You cannot label it as exploitation.
Okay, thank
Forget
you, sir.
it.
Thank you, sir. So,
Thank
to
you,
be
sir.
frank, dear delegates, दोन मित्रांमध्ये भांडण लावणं खूप अवघड गोष्ट असते. But still we have achieved, we have been successful to make these two friends fight on the stage. So thank you very much. We would like President sir to felicitate Anil Patil sir. Okay, instead what we'll do, Dr. Sharad Jagtap sir will felicitate Dr. Anil Patil sir and vice versa.
या की सगळे उभं राहा.